All right, so this is chapter 5, part 2, connective tissues. And I'm having to re-record this kind of in a hurry, so I apologize. I don't have a more professional appearance. And so we're just going to move forward and get this one done here. So we're going to look at the connective tissues. So we've talked a lot about understanding those general characteristics of each type of tissue so that we can learn to tell them apart without just trying to memorize. So connective tissue is the most abundant tissue type that we have. It consists of cells with a lot of extracellular matrix. It contains the most diversity when we look at the components. And of course, I already said it's the largest tissue type that we have. Remember that tissues are groups of cells that have a common overall function. All right, so they're a group that has come together with the sole purpose in mind. They're distinctive in their characteristic cell types and in the types of molecules that they can produce. So the functions for connective tissues include things like binding structures together, giving us some more support and protection and framework, fill certain spaces, store fat, produce blood cells, protect against infections like antibodies, which we're hearing so much about the antibody testing with this COVID-19, and even repair tissue damage. So these are very, very diverse in what they are able to do. They do a lot of things. So they have different amounts of vascularity. So some are very vascular and some are not very vascular at all. And these guys have cells that usually do divide. There are some exceptions to that. All right, so we have some different types of cells in connective tissue, and we can break those down into two categories. We have fixed cells, which like to stay in place. And then we have wandering cells, which will move in and out of tissues temporarily, often in response to an injury or an infection. So for our fixed cells, we have fibroblasts and mast cells. Fibroblasts here are the most common type of fixed cell in a connective tissue. These guys are large and star-shaped, and these produce some different fibers in connective tissues. Mast cells over here, these are often found near red blood cells, and they release heparin and histamine. Heparin prevents blood clotting, so that's really important, and this is why they're located near blood, because that's where we need them. Histamine, you probably have heard of an antihistamine before, and that's something we take in order to stop the action of histamine. Histamine promotes inflammation and allergy infections, things such as asthma and hay fever. Macrophages are the wandering type. These can also be called histiocytes. And these start out as white blood cells, and we have a lot of these guys. They are very specialized to carry on phagocytosis, and that's the reason for that is to clear away foreign particles from different tissues as part of your immune system. So that's very important. So we have a few different connective tissue fibers that we will see in here as well. Fibroblasts are going to produce 3 types of connective tissue fibers, okay? That's 3. These are going to be the major structural proteins that we find in the body. They're thick, thread-like, grouped in very long parallel bundles. They're flexible, but yet they're not very elastic. They do have a very great tensile strength, and that means they really uphold well to a pulling force. We use these to construct ligaments that connect bones to bones and to make tendons which connect muscles to bones. So these need to be tough, okay? These do sometimes appear white when you have a lot of them, and so we will call them sometimes white fibers, all right? And so we have collagenous fibers here in this picture, and then we have some elastic fibers that are stained, well, they're not stained, it's colorized yellow. All right, so elastic fibers and reticular fibers are 2 of these types here. Elastic fibers are made of a protein called elastin. That's pretty handy, right? These are weaker than the collagenous fibers. They stretch and deform or lose their shape easily, but then they return to their shape. So think elastic, think rubber band. Okay, so a rubber band is very elastic, right? And it bounces back to shape after you pull it. They're found in areas of the body where stretching occurs, where you need to be able to stretch, like your vocal cords and your air passages. So they often are colored yellow in color, so we call those yellow colors, and then collagenous we call yellow fibers, sorry. Collagenous we call white fibers. So next we have reticular fibers, and these are very thin collagenous fibers, so there's still collagen here. They have lots of branching and form very delicate networks in tissues in areas like the spleen. Collagen is all over the human body. It makes up about 60% of the protein found in your bone and cartilage. We even have it in areas like the eyes, blood vessels, basement membranes, and connective tissues. Being so abundant in the body, there are lots of medical problems that are associated with abnormalities of collagen. Collagen is easily disrupted, especially by mutagens, changes in the structure, like if they're missing a procollagen, which is like a precursor molecule. So they could be missing a procollagen in the chains, kinks, or in other areas. And that's basically like if you were missing one of those amino acids in a protein, it throws the whole structure off. So here are some different abnormalities of collagen. We have Marfan syndrome, where you don't have enough of the elastic connective tissue, fibrillin, and that causes you to have very long limbs, a sunken chest, which they sometimes call pigeon-chested. I think that's what they call pigeon-chested. Limbs can dislocate, long, spindly fingers, and they do have a very weak heart. So read about all of these here. I think there might be a link for a video on one of these. I'm not 100% sure, but if so, be sure to watch it because it's pretty interesting. So we've got two major categories for connective tissues. This includes connective tissue proper, loose connective tissues, and those are things like areolar, adipose, reticular, dense connective tissues, regular, irregular, elastic. And then we have specialized connective tissues that are actually things we don't really think of as being, or some of the things we don't think of as being tissues. Cartilage you might think of as a tissue, but bone and blood, we don't normally in our own minds think of that as a tissue, but this is a special type of connective tissue. So which type of tissue is the main tissue you would find in cartilage? Well, that's of course going to be connective tissue. Okay. Dense connective tissues appear white and their fibers are white. Loose connective tissues have only a few collagenous fibers. All right, so the first type of connective tissue here we're looking at is areolar. This tissue forms thin, delicate membranes. It is made mostly of fibroblast, and it contains a gel-like ground substance, and we call it the ground substance. And it contains collagenous and elastic fibers. We will find this under the subcutaneous layers of the skin. It underlies most epithelium, where its blood vessels can come up and nourish the cells. All right, and so you can see this areolar here. This is one of my favorite types because it's just really kind of pretty, and it almost looks like a Jackson Pollock painting. And that's not the prettiest picture of areolar I've ever seen, but it is pretty unique, and it has lots of nice little features here to help you identify it. And then we have adipose connective tissue, and you are very familiar with this. This is fat, all right? Adipose connective tissue develops when certain cells like that we call adipocytes begin to store fat in their cytoplasm. They start out looking kind of like a fibroblast, but then they start to hold that fat and gain fat, and they swell and get so large that the nuclei is actually shoved to the side over here. So these dark spots, those are nuclei, and they're shoved to the side. Okay. When adipocytes become so abundant that they crowd out other cell types, then they come together to form connective tissues. This is found beneath the skin, between muscles, and around the kidneys and the heart, and the function is to insulate and store energy. All right, so next we're looking at reticular. Reticular connective tissue. This is another fine network or net-like structure. It highly branches. It's made of thin reticular fibers in a 3D type network. This acts as a framework of support for internal organs like the liver and the spleen. And if you look at this little picture over here on the right, the way these fibers branch, they look kind of like little twigs, and that's pretty distinctive for reticular. So this one should be a little bit easier one for you to identify because it's kind of unique looking. Look at the way that they actually branch, and there's not a pattern to them. They're not straight lines like some of the stuff we see in the areolar. They're just highly branching, and to me it just looks kind of like twigs. All right, so dense, dense regular connective tissue. Be careful with some of these connective tissues. Sometimes students mistake for muscles, so you have to pay really close attention to the distinctive characteristics. So these are closely packed, thick fibers. They're collagenous and elastic fibers. These are very, very strong, and they withhold to pulling forces. They're used to bind body structures as part of tendons and ligaments. These do have a very poor blood supply, so this is why if you hurt or pull a tendon, this tends to be a much more serious actual injury than a broken bone. A broken bone can heal in 6 weeks. If you sprain your ankle moderately or severely, that can take almost up to a year to completely heal. And sometimes they're just not the same because there's no blood supply. Well, why does it matter if there's no blood supply? Well, what brings nutrients, white blood cells, and things up to clean up, right? And to restore tissue and help tissue heal. That's the blood, okay? And so if we can't get those little EMTs there to work on the injuries, then we can't really heal very well. So these take a long time to heal, okay? All right, so dense, irregular connective tissue. The other one had very regular striations almost to it. This one, you can see, these are just kind of going all over the place. There might be some going the same direction here, but then they're going a complete opposite direction there. So this is irregular. They don't have any regularity to them. These are going to be thicker and more randomly organized, is another way to say that. This organization allows the tissue to undergo tension forces in all different directions. So if you think you had a piece of fabric and you pull it this way, and it was the connective tissue we were just looking at, it might hold up well that way. But if I was to pull it this way when the layers are going this way, I could separate that a lot more easily. Whereas this one, where the fibers are just going all which ways, I can kind of pull that from any side, and I'm not going to tear it near as easily, all right? And so remember that structure determines function. And so you can look at it the opposite way as well. Whatever the function is, the structure has to fit that, okay? And so having this disorganization in all directions allows it to sustain itself around those tension areas where you get a lot of tension forces in different directions. You'll find these often, of course, where skeletal muscles are, which is where we're usually going to have a pulling type force. All right, so elastic connective tissues. These are mostly yellow elastic fibers. They're kind of parallel, and they do have some branching to them, so they have some branching networks. We've got collagenous fibers and fibroblasts that are sometimes found in between the layers here, and you can see that fibroblasts highlighted in yellow here, and see how these are kind of running parallel here. Okay, you'll find these in areas like walls of your heart, large arteries, airways, those types of things. Cartilage is a rigid connective tissue that provides support, it provides attachment, protection, and can actually form a structural model for developing bones in a fetus. The extracellular matrix is going to be made of collagenous fibers in a gel-like ground substance. We have chondrocytes, and these, especially in two of these types of cartilage, that kind of look like octopus suckers. And you can kind of see these here. Pick a different color. These little round structures here, okay? And these are lacuna, and lacuna, I think, a lagoon. And so we have lacuna, and in that lacuna, you can see that we have what we call a chondrocyte. And so the lacuna is the actual cavity that they are in. And you can see these are very distinctive here in elastic cartilage and hyaline cartilage. Fibrocartilage is a little bit harder to see them, so we have to be more careful with that one, okay? So perichondrium is a cartilage, surrounds the cartilage. The peri means around, and then chondrium refers to the cartilage. So they have a perichondrium around them, a covering. These do not have a blood supply. They obtain their nutrients from nearby blood vessels outside of the perichondrium, and that occurs via diffusion. And so this is why torn cartilage just does not heal very well, if at all. Okay. And so we've got three types here. We have hyaline cartilage, elastic cartilage, and fibrocartilage. So let's go take a look at those. All right, so here's hyaline cartilage, and this is another one of my favorites that I just kind of think is kind of pretty and neat looking. This is the most common type. We've got fine collagenous fibers in the extracellular matrix, and that's going to help you to identify which type of the three types of cartilage it is. Okay, so one is going to be looking at the chondrocytes and how many of them there are, and the other is, do you have a scratchy or a glassy extracellular matrix. This one has a glassy or more clear looking extracellular matrix. You don't see what looks like scratches in there. This is found on the ends of long bones. It's found in many joints, soft parts of the nose, the supporting rings of your respiratory passages, and the embryo skeleton actually starts out as a cartilaginous, hyaline cartilaginous model, and then that is replaced by bone. So that's really pretty cool. Okay. This is also part of the development and growth of most bones. Elastic cartilage is more flexible than hyaline because the extracellular matrix has a dense network of elastic fibers. This forms the framework for the external ears and part of the larynx. Right? You can see it has kind of that scratchy appearance here to the extracellular matrix. You see those lines here, and it's kind of scratchy looking, and you'll see that much more in your lab section for this. Lastly is fibrocartilage. This one isn't quite as distinctive as the other two. You do still have some chondrocytes, but they're much, much smaller. Fibrocartilage is, however, very, very tough. It has lots of collagenous fibers in it, and it kind of acts in our body as a shock absorber. So you're going to find it in places like your vertebral disc, your intervertebral disc between the vertebrae and the spinal column. And you'll also find it as a cushion in your knees and areas like your pelvic girdle. So it really takes a good impact. All right, so bone, this should be a really easy one for you to identify. I always get really disappointed when I see students miss this one because I'm very particular about which slides I choose. I don't, sometimes we have longitudinal sections and sometimes we have cross sections. And one of those is much harder to identify bone, and I try to stick with this view here where it actually looks like little rings of wood, okay, so because it's very distinctive. This is the most rigid, of course, connective tissue. The hardness occurs due to mineral salts like calcium phosphate and carbonate. It contains some flexible collagenous fibers that help to reinforce those mineral components in the bone. This acts to support and protect vital structures and attachment for muscles. This also contains red marrow, which is where we form our blood cells, so that's really important. It also stores and releases those inorganic, inorganic ions, calcium and phosphorus from those salts. So it does serve as storage there. In compact bone, and you'll see we have more than one type of bone, we have two. In compact bone, the matrix is deposited by what we call osteoblast, and it's laid down in layers called lamellae. And you see that word is right here. Okay, it ends with an A, singular, E when plural. So these form these concentric circles here that you see around longitudinal tubules, and we call these central canals or haversian canals here. This is your central or haversian canal. You can use either term, they're both correct. Then once osteoblasts are in the lacuna surrounded by matrix, then we call those osteocytes. So it's kind of a maturity thing, like child or adolescent. Okay, osteocytes and extracellular matrix are clustered in those circles, that concentric cluster around they form what we call an osteon or haversian system. Okay, so this whole circle here, that is one osteon. Okay, you could also say haversian system. So haversian canal, and then the whole thing together is the haversian system. These canals have blood vessels that go through them. So injured bone here heals much quicker than cartilage because you have an increased blood supply to bring your little EMT workers there to fix everything up. All right, and so cartilage tissues are likely to be slow in healing, but bones heal much, much quicker. All right, so here's another really good distinctive connective tissue that you should not have any trouble identifying, and that is red blood cells, blood. Blood is a connective tissue, so be sure you know that, because you're probably going to see that on either your lecture exam or your lab exam. So you're going to need to know your 4 categories and where everything fits in. Most of them, it's in the name, all right? But of course, blood doesn't have connective tissue in the name. Bone doesn't have connective tissue in the name. So you need to be sure you know where those fit, all right? So white blood cells migrate from blood through capillary walls to connective tissues to do their jobs. And if you look at this picture here, we have some different things. These red little donut-looking circles are concave disc. These are the red blood cells. These guys here are white blood cells, and there's different types of those. And then the little darker portions here, those are platelets, or their cell fragments, okay? And of course, the function of blood is to transport all the different molecules that we need in the portions of the immune system. So water, gases, oxygen, all types of things. So we've got 4 types of epithelial membranes, and there's a reason why these are here and not with epithelium, so don't get too stressed about that. You just need to know the different types of membranes, all right? Membranes are basically sheets of cell. Epithelial membranes are usually composed of epithelium and their underlying connective tissue, all right? And so that's why this is found at the end of the connective tissue lecture, because it's both. So they cover body surfaces and they line cavities, and we've got 4 basic types here: serous, mucous, cutaneous, and synovial, all right? Serous membranes, and this is important, line cavities that do not open to the outside. That is the important distinction. Do not open to the outside, okay? They function in reducing friction between organs and the cavity walls. They form the inner lining of things like the thorax and the abdomen. They cover organs, and they have cells that will secrete a serous fluid to help lubricate membrane surfaces. That is important. If you have ever had pleurisy, you know how painful it is when you have friction between these membranes, all right? Pleurisy is irritation of the pleura that you can often get after being sick. It's sick and it gets irritated, and every breath basically feels like you are being stabbed, all right? And depending on how bad you get it, sometimes it hurts when you move, and sometimes it just hurts all the time, but it's bad. And you wouldn't think a tiny thing like a membrane could cause so much pain, but it really can. Trust me. So mucous membranes line cavities and tubes that open to the outside, okay? These open to the outside of the body. So really important to remember the difference between those two, all right? So these include things like the oral or nasal cavity, tubes of the digestive system, respiratory, urinary, reproductive system tubes. These are made of epithelium and usually a layer of areolar, and the epithelium that goes along with that can vary. And so if they're mucous membranes, they need a mucus secreting cell. You remember the name of the mucus secreting cell? You may not be there yet in lab. They're goblet cells. You drink out of a goblet. Well, a goblet cell holds something as well, but it's not anything you want to drink. It's mucus. All right, so these actually produce the mucus, but that mucus is really important. Cutaneous membranes. This is going to be the skin, so it's part of the integumentary system. And then we have synovial membranes that line joints. So you want to think of a joint here, all right? These are made entirely of connective tissues. You'll find this in places like the nose, things where you also will have mucous membranes as well, not the synovial membranes. Sorry, I was thinking about mucous membranes. Synovial membranes are going to be more like areas like your knee where you have joints, okay? Off topic there, sorry. Well, not off topic, but I got out of place. All right, so that should do it for this. I'm going to try to get this up as quickly as I can, and if you have to wait on it, I so much apologize. They looked like they all uploaded correctly. I really don't know what happened. So if you find that, always let me know immediately.